Today we're having a real, honest conversation about something most men don't think about until it becomes impossible to ignore: the prostate. That small gland, roughly the size of a walnut, sits quietly just below your bladder, doing its job without complaint. But when it starts causing trouble, it can completely change your daily life, waking you up multiple times at night, making your urine stream weak or inconsistent, or giving you that urgent feeling to go again minutes after you've just finished. Before we dive into these critical habits, I want to tell you about our private senior health community, where health-conscious seniors connect, share experiences, and get expert guidance on issues like this. We offer weekly group calls, monthly expert sessions, and a supportive environment where you can ask the questions you might not feel comfortable discussing elsewhere. Check the link in the description. I've also created a free prostate health checklist that includes everything we'll cover today, plus additional strategies. You'll find the download link below. These symptoms often point to an enlarged prostate, a condition affecting more than half of men by their 50s and nearly 90% of men over 80. Here's what many don't realize. While aging naturally plays a role, a huge part of what drives prostate swelling comes down to daily habits you might be doing for years without realizing their impact on your prostate health. Today, I'm walking you through 6 common habits that quietly but steadily contribute to prostate enlargement. I'll share real examples from men who learned the hard way what they were doing wrong, and more importantly, what they did right to turn things around. Let's dive in. This is the biggest mistake almost every man makes, thinking, if I feel fine, I'm fine. The truth is, prostate changes often sneak up slowly and silently. You might not notice symptoms until the swelling has reached a point where treatments become more invasive and options become limited. Paul hadn't seen a doctor in 6 years. Feeling fine on the surface, he thought he was in the clear. But behind the scenes, his prostate was quietly enlarging, and now he wakes up 3 times nightly just to use the bathroom. His brother Steve sees his doctor annually, regardless of how he feels. Steve's doctor caught early signs of prostate issues and addressed them before they became a major problem. Prostate enlargement, or benign prostatic hyperplasia, typically develops gradually over years. Early detection allows for lifestyle interventions, medications, or minimally invasive procedures that can prevent progression to more serious complications like complete urinary retention or kidney problems. Here's your first actionable step. Schedule an annual checkup even if you feel perfect. Ask your doctor about a digital rectal exam and PSA test if you're at the appropriate age. Keep a brief log of any urinary symptoms you notice: urgency, frequency, weak flow, or nighttime bathroom trips, and bring that information to your appointments. It helps your doctor spot changes early and track your prostate health over time. Early intervention can often prevent the need for surgery and maintain your quality of life for years longer than waiting until symptoms become severe. Your pelvis is a busy hub of blood vessels, nerves, and muscles. When you park yourself in a chair for hours without moving, it's like causing a traffic jam in that area. Blood flow slows down, pressure builds in your pelvic floor, and over time, this starves your prostate of the circulation it needs to stay healthy. Prolonged sitting increases pressure on the perineum, the area between your scrotum and anus, which can compress the prostate and restrict blood flow. Poor circulation means less oxygen and nutrients reaching prostate tissue, while also allowing waste products and inflammatory substances to accumulate. Tom spends hours in his recliner watching TV, barely standing up once all day. By evening, his hips ache, and he feels dull discomfort in his pelvic area. His friend James watches the same shows but stands during every commercial, walks around briefly, and does gentle stretches. James notices better circulation and less pelvic pressure, giving his prostate much needed relief. The solution is simple but requires consistency. Set a reminder on your phone or watch to stand up every 45-60 minutes. During TV time, try marching in place or doing light squats. Even swapping one seated hobby per day for a standing or walking activity makes a significant difference. If you work at a desk, consider a standing desk option for part of your day, or take walking meetings when possible. These movement breaks don't need to be long. Even 2-3 minutes of standing and light movement can restore healthy circulation to your pelvic region. Excess abdominal fat isn't just a cosmetic concern, it's metabolically active tissue that releases hormones and inflammatory chemicals capable of throwing your body's hormonal balance off course. Too much belly fat raises estrogen levels and triggers chronic inflammation, both of which can fuel prostate growth. Visceral fat, the deep abdominal fat surrounding your organs, produces inflammatory cytokines and converts testosterone to estrogen through an enzyme called aromatase. Higher estrogen levels in men are directly linked to prostate enlargement and increased cancer risk. Ed carries most of his weight around his stomach. He finds himself tired more often, less active, and waking up multiple times nightly. His neighbor Ron shed 15 pounds over 4 months by walking 25 minutes daily and replacing sugary drinks with water. Ron's energy soared, and he now wakes only once nightly instead of 3 times. Focus on gradual weight loss of 1-2 pounds monthly through sustainable changes. Emphasize whole foods, lean proteins like fish and poultry, and fiber-rich vegetables that help reduce inflammation. Add low-impact exercises like walking, swimming, or cycling to boost metabolism without placing excessive strain on joints. Even a modest 10-pound weight loss can significantly reduce inflammatory markers and improve hormonal balance. The key is consistency rather than dramatic changes that are difficult to maintain long-term. Regular exercise is a powerful prostate protector because good circulation supports every organ, including your prostate. Exercise reduces systemic inflammation, helps balance hormones, and strengthens the pelvic floor muscles that support urinary function. You don't need to train for marathons. Consistent, moderate activity is enough to maintain healthy prostate function. Physical inactivity leads to poor circulation, muscle weakness, and increased inflammation throughout the body. The pelvic floor muscles, which help control urination, become weak without regular use, contributing to urinary symptoms even when prostate enlargement is mild. Mark spends most days sitting, barely moving beyond the couch and kitchen. His stamina and muscle tone are declining, negatively affecting his circulation and overall health. His business partner Leo walks briskly for 30 minutes, 5 days weekly, tends his garden on weekends, and swims occasionally. Leo enjoys stronger pelvic muscles, better circulation, and healthier prostate function. Start small if needed. Try brisk walking, light weight training, or water aerobics. Breaking activity into 10-minute chunks several times daily works as well as one longer session. Include specific pelvic floor exercises like Kegels to give extra support to your urinary system. Activities that promote pelvic circulation are particularly beneficial. Walking, swimming, and cycling all help maintain healthy blood flow to the prostate region while strengthening supporting muscle groups. Water is your body's natural cleanser, and when you don't drink enough, your urine becomes concentrated with irritants that can inflame both your bladder and prostate. Chronic dehydration leaves your entire urinary tract bathed in these concentrated irritants, setting the stage for inflammation, swelling, and discomfort. Concentrated urine contains higher levels of minerals, toxins, and waste products that can irritate the delicate tissues lining your urinary tract. This chronic irritation triggers inflammatory responses that can contribute to prostate swelling and urinary symptoms. Bob's routine is unfortunately common. Coffee in the morning, maybe a soda at lunch, and a small glass of water with dinner. His urine is consistently dark, and he sometimes experiences burning sensations. Frank keeps a water bottle beside him and refills it 3 times daily. His urine stays light yellow, his bladder feels comfortable, and his prostate experiences less irritation. Aim for 6-8 cups of water daily unless your doctor advises otherwise due to heart or kidney conditions. Include water-rich foods like cucumbers, melons, and oranges in your diet. Try to reduce high-sodium snacks and processed foods that increase your body's water needs. Proper hydration also helps flush bacteria and toxins from your urinary system, reducing infection risk and maintaining healthy tissue function throughout your urinary tract. Tobacco smoke contains thousands of chemicals that damage blood vessels and spark inflammation throughout your body. The prostate's tiny blood vessels are especially sensitive to these toxins, so smoking or exposure to secondhand smoke impairs circulation, slows healing, and promotes chronic inflammation that fuels prostate enlargement. Nicotine and other tobacco chemicals cause blood vessels to constrict, reducing oxygen delivery to tissues. They also increase oxidative stress and inflammatory markers that directly contribute to prostate problems. Even secondhand smoke exposure carries significant risks. Rick enjoys weekly card games but plays in a smoke-filled room. Even though he doesn't smoke himself, his prostate is still exposed to harmful toxins. His friend John used to join him, but moved their gatherings to a smoke-free cafe. John still enjoys his social time without compromising his prostate health. If you smoke, talk to your doctor about effective quitting strategies, including medications, nicotine replacement, or counseling programs. Avoid enclosed spaces where others smoke, and replace smoking breaks with short walks or stretches to maintain activity levels. The good news is that many of smoking's harmful effects on circulation and inflammation begin reversing within weeks of quitting, making it one of the most impactful changes you can make for prostate health. These 6 daily habits, avoiding medical care, prolonged sitting, carrying excess belly fat, lack of exercise, chronic dehydration, and smoke exposure, may seem unrelated to prostate health, but they work together to either support or undermine this crucial gland's function over time. The encouraging reality is that you have more control over your prostate health than you might realize. While aging and genetics play roles, the lifestyle choices you make every day have enormous impact on whether you'll experience minor inconveniences or major disruptions to your daily life. Your challenge for this week? Choose one habit from today's discussion and make a specific, measurable change. Whether it's scheduling that doctor's appointment, setting hourly movement reminders, starting a daily walk, or increasing your water intake, take one concrete step toward better prostate health. Don't forget to download your free prostate health checklist. It includes everything we covered today, plus additional strategies, warning signs to watch for, and a simple tracking system to monitor your progress. The download link is in the description below. If you want ongoing support, expert guidance, and connection with other health-conscious men facing similar challenges, join our private senior health community. We offer weekly group calls where you can ask questions you might not feel comfortable discussing elsewhere, monthly expert sessions with specialists, and a supportive environment focused on men's health after 50. Check the link in the description. For those interested in products that support prostate health, I've included links to items I personally recommend. You can also find more detailed information about men's health and aging on our blog. Remember, small changes today can prevent major problems tomorrow. Take care of yourself, listen to your body, and I'll see you in the next video.